In this podcast, we'll continue looking at legal and ethical issues as described in Chapter 1. The particular objective is to just contrast these two vocabulary terms, standard of training and standard of care. When we consider the scope of your training, understand that you may be actually trained in about 3 different levels of emergency care. There is just the National Ski Patrol OEC curriculum. Now you can combine that with local protocols for emergency care. What that means is maybe the doctor at your ski area allows for additional procedures. Finally, there may be state laws and regulations governing EMS and some of the protocols that are there. It is really important for you to understand your role and your level of training. When you provide first aid services, you have to remember that your level of training is specifically the National Ski Patrol OEC curriculum. The textbook is a reference for everything that you should know and be able to do. Now, by exercising sound judgment and acting within that standard of training, you're really going to reduce your legal risk. Now, a level of care is that combination of what you have been trained through this OEC course combined with local medical protocols. And it is your responsibility to understand those additional elements. When we put together the level of training in OEC with the local protocols provided by your ski area or the medical advisor there, that's what we have as a standard of care. Now, keep in mind, when you work at a ski area, you're patrolling as an agent of the ski area. This is in particular part of a memorandum of understanding between the National Ski Patrol and the National Ski Areas Association. National Ski Patrol only provides the education for OEC in the classroom and practically on the slopes. The National Ski Patrol does not control your activities while patrolling. The ski area will bear legal responsibility for you when you function as a patroller. To summarize, the standard of training is simply this course. The standard of care is when we take this training and combine it with local medical protocols from your area or its medical advisor and any requirements of the state EMS system.